And I am Dr. Natesh, Senior Consultant, Virinchi Hospitals and Professor of Orthopedics at Iron Medical College. And today's topic is arthritis. Arthritis is a condition where patient experiences pain when movement around a particular joint. The pain is because the two articulating surfaces of bones, which are supposed to be smooth against each other with almost zero friction, will develop friction because the bones against each other become rough, and the bones will be when there is movement between the bones, there will be a lot of pain and the patient experiences pain, and this may be associated with swelling and reduction in movement between the surfaces. Because of arthritis, the patient may be restricted to indoor activities and he may completely lose his social life, like attending parties, functions, marriages, etc. And that will also have an impact on the psychology of the patient, and he'll feel psychologically low. As arthritis damages joint surfaces and it is a progressive disease, one has to identify the early symptoms of arthritis like pain, and he has to consult his orthopedic doctor in time so that the progression of the disease will be restricted and the patient will have very good outcomes. Remember, movement is life, and because when we can reduce pain in the joints, we can move about and we can completely relish our life. For arthritis, to prevent arthritis, we have to restrict our lifestyle, like avoiding alcohol, smoking, and our body weight should be maintained in an ideal range. Arthritis can happen to anybody, and most common form of arthritis is degenerative arthritis, and that is caused because of age, and it can be caused because of trauma. When there is a fracture around a particular joint, the articulating surfaces may become uneven because of fracture, and then that may cause arthritis. And there can be arthritis because of some other diseases like gout, where the bone there will be uric acid accumulation into the joint, and rheumatoid arthritis can be there, where there is a progressive damage to the joint and the patient will have pain. When we have arthritis, the patient will feel that particular joint, the movement is painful, and also the patient may feel a grating sensation around when he attempts to move that particular joint. And that grating sensation is because the articulating surfaces are becoming rough. Arthritis do not cause numbness around a particular joint, and popping sounds or crackling sounds around a particular joint, especially knuckles in the hand, when we try to twist them, when we stretch the capsule, will not cause arthritis, and they are not a symptom of arthritis. Arthritis can happen at any age, and infantile rheumatoid arthritis is increasing as daily. Arthritis can cause symptoms like swelling in particular joints, and it will be associated with reduced range of motion in that particular joint, and this can be diagnosed with standing x-rays or loading x-ray of that particular joint, where you can clearly see the joint surfaces are close to each other because of erosion of the joint cartilage, and when the patient is moving the joint, there will be pain. Regarding treatment of arthritis, without medications, we can reduce pain from the joint by just simple exercises and strengthening the muscles around that particular joint. This will reduce the pain from the joint. Stretching exercises can prevent development of arthritis, and even in rheumatoid arthritis patients, if it is possible, after your doctor's advice, you can do stretching of the joints regularly so that the joints will become supple and there won't be any further progression of arthritis. Usually glucosaminoglycans and diacerin and other undenatured collagen and other collagen preparations are regularly used for arthritis of patients, along with painkillers, so that the joint is recovered, the pain from the joint is gradually reduced, and functional joint is restored to the patient.